Welcome to another episode from the Veterinary Research Channel. Today, we delve into a fascinating study published in the Journal of Veterinary Internal Medicine in 2024. This research compares certain blood-related variables in dogs diagnosed with two types of congenital portosystemic shunts, intrahepatic and extrahepatic. Congenital portosystemic shunt is described as a common vascular abnormality in dogs. In this condition, an abnormal blood vessel allows blood to bypass the liver, the body's natural filtration system. These shunts are broadly categorized based on their location relative to the liver. Intrahepatic portosystemic shunts occur within the liver. Interestingly, dogs with this type of shunt are more prone to inflammation, ulceration, and bleeding in their gastrointestinal tracts compared to dogs with extrahepatic portosystemic shunts, which occur outside the liver. The researchers noted that while the existence of these two types of shunts and some of their associated issues were known, there was limited information specifically comparing the blood-related differences between dogs with intrahepatic shunts and those with extrahepatic shunts. Therefore, the objective of this study was to compare various components of the complete blood count, also known as a hemogram, between these two groups of dogs. The scientists hypothesized that they would find differences in these blood variables, specifically anticipating a higher occurrence and severity of anemia, a condition characterized by a deficiency of red blood cells or of hemoglobin in the blood, and microcytosis, a condition where red blood cells are smaller than normal, in dogs with intrahepatic portosystemic shunts. To conduct this study, the researchers retrospectively reviewed the medical records of client-owned dogs diagnosed with congenital portosystemic shunts at the Oregon State University Veterinary Teaching Hospital between 2011 and 2022. They included dogs that had a confirmed single congenital portosystemic shunt, diagnosed using advanced imaging techniques like computed tomography or ultrasonography performed by a board-certified radiologist. Additionally, the dogs had to have a complete blood count performed before any surgical or other intervention to correct the shunt. This blood work was done at the Oregon Veterinary Diagnostic Laboratory. Ultimately, the study included 26 dogs with intrahepatic portosystemic shunts and 35 dogs with extrahepatic portosystemic shunts. The researchers analyzed the frequency of clinical signs observed in both groups of dogs, as well as the occurrence of various blood-related measurements falling below the normal reference range. They also compared the average values of hematologic and certain biochemical variables between the two groups, taking into account the age of the dogs as a potentially influencing factor. Turning now to the results of their investigation, the researchers found several significant differences between the two groups of dogs. They observed that gastrointestinal clinical signs were much more common in dogs with intrahepatic portosystemic shunts, with 81% of these dogs showing such signs compared to only 34% of dogs with extrahepatic shunts. Specifically, these signs included changes in appetite, vomiting, bloody stool, diarrhea, and excessive salivation. Furthermore, the study revealed that anemia, defined as a packed cell volume below 36%, was significantly more frequent in dogs with intrahepatic shunts, 31%, than in those with extrahepatic shunts, 6%. Similarly, microcytosis, indicated by a mean corpuscular volume below the reference range, was also significantly more common in the intrahepatic shunt group, 77%, compared to the extrahepatic shunt group, 29%. Hypochromia, a condition where red blood cells have a reduced concentration of hemoglobin and appear paler, was also more frequent in dogs with intrahepatic shunts, 77%, versus extrahepatic shunts, 49%. When comparing the actual blood values, dogs with intrahepatic shunts had significantly lower packed cell volume, hemoglobin concentration, mean corpuscular volume, mean corpuscular hemoglobin, and mean corpuscular hemoglobin concentration compared to dogs with extrahepatic shunts. Mean corpuscular volume, a measure of the average volume of a red blood cell, was notably lower in the intrahepatic group, 57 FL, compared to the extrahepatic group, 65 FL. Similarly, hemoglobin concentration, the amount of oxygen-carrying protein in red blood cells, was lower in the intrahepatic group, 11.5 g/dl, versus the extrahepatic group, 13.7 g/dl. Interestingly, the study also found that dogs with intrahepatic shunts had significantly lower levels of blood urea nitrogen and higher levels of cholesterol in their blood compared to dogs with extrahepatic shunts. Blood urea nitrogen is a waste product normally processed by the liver, and cholesterol is synthesized by the liver, so these findings suggest potential differences in liver function between the two groups. The researchers concluded that dogs with congenital intrahepatic portosystemic shunts exhibit a higher frequency of anemia, microcytosis, and hypochromia compared to dogs with extrahepatic shunts. They also experienced gastrointestinal clinical signs more often. Even when their blood values were still within the reported reference ranges, dogs with intrahepatic shunts tended to have lower median values for hemoglobin, packed cell volume, mean corpuscular volume, mean corpuscular hemoglobin, and mean corpuscular hemoglobin concentration than dogs with extrahepatic shunts. This highlights the importance of careful evaluation of blood test results and trends in dogs known to have portosystemic shunts. In their discussion of these findings, the researchers considered the potential reasons for the observed differences. They noted that the increased predisposition of dogs with intrahepatic shunts to gastrointestinal inflammation, ulceration, and bleeding could contribute to the higher frequency and severity of anemia and microcytosis. While overt signs of upper gastrointestinal bleeding, such as the presence of digested blood in the stool, melena, or vomited blood, hematemesis, were not very frequent in the intrahepatic shunt group in this study, the researchers acknowledged that subclinical bleeding could still be occurring and leading to iron deficiency. It's known that even small amounts of chronic blood loss can lead to iron depletion over time. The study referenced previous research indicating that dogs with intrahepatic shunts commonly show signs of mucosal irritation and ulceration upon endoscopic examination. One study found that a significant percentage of dogs with intrahepatic shunts had evidence of gastrointestinal hemorrhage and ulceration, even after treatment, to reduce the shunt. The fact that some dogs in the current study were receiving medication to reduce stomach acid at the time of their blood tests might have even underestimated the true frequency of gastrointestinal ulceration and its impact on blood parameters. The researchers also discussed the complex issue of iron status in dogs with portosystemic shunts. While previous studies have suggested that dogs with congenital portosystemic shunts often exhibit changes consistent with functional iron deficiency, where iron is not properly utilized despite adequate stores, the current study's findings raise the possibility of absolute iron deficiency in some dogs with intrahepatic shunts due to chronic blood loss. One prior study even noted lower iron staining in the liver tissue of dogs with intrahepatic shunts compared to those with extrahepatic shunts, further supporting this possibility. The authors emphasize the need for future research to more thoroughly investigate iron status in dogs with intrahepatic shunts, as this could have implications for treatment, such as the potential benefit of iron supplementation in addition to medications for peptic ulcers. The lower blood urea nitrogen and higher cholesterol levels observed in the intrahepatic shunt group were also considered. Both urea and cholesterol are produced by the liver, and their altered levels could suggest a greater degree of liver dysfunction or more significant shunting of blood away from the liver in dogs with intrahepatic shunts. However, the researchers cautioned that many other factors can influence these blood values, such as diet and gastrointestinal issues, so further investigation is needed to understand the significance of these differences. The study also corroborated previous findings that dogs with intrahepatic shunts are more likely to exhibit gastrointestinal clinical signs. This is consistent with reports of inflammatory changes in the lining of the gastrointestinal tract in these dogs. The exact cause of this increased gastrointestinal involvement in intrahepatic shunts warrants further study to optimize monitoring and treatment strategies. Finally, the researchers addressed some limitations of their study. They noted that they did not have access to more advanced red blood cell measurements, such as respiratory hemoglobin content, which could provide more specific information about iron availability for red blood cell production. They also acknowledged that while most blood samples were processed promptly, some may have been stored overnight, which could slightly affect certain blood parameters, although proper refrigeration likely minimized this effect. Importantly, the assessment of gastrointestinal hemorrhage relied on the clinical signs documented in the medical records, which may have underestimated the true prevalence of bleeding. Future studies could incorporate more direct measures of gastrointestinal bleeding and iron stores. The fact that a few dogs in the study had received blood transfusions shortly before their blood tests could have also influenced the results. In conclusion, this study provides valuable insights into the hematologic differences between dogs with congenital intrahepatic and extrahepatic portosystemic shunts. The findings clearly indicate that dogs with intrahepatic shunts are more prone to anemia, smaller red blood cells, and a reduced concentration of hemoglobin in their red blood cells, and they also experience gastrointestinal signs more frequently. The researchers emphasized the need for further investigation into the iron status and gastrointestinal health of these dogs to improve their long-term management. Thank you for listening to the Veterinary Research Channel. A link for the referenced paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.